So thank you for joining us for this marketplace room on innovations in education. As you know, this marketplace is one of the most interactive events of the summit, as we will be listening to stories, ideas, and projects that organizations around the world have implemented during this COVID-19 pandemic. This is specifically related to the health workforce innovations. So you will be listening to presentations around this topic. We encourage you all to actively participate, ask questions, and share ideas with our presenters. As I mentioned before, please use the chat on your right to send your questions to us. Participant microphones are currently muted. Please use the chat box, to type in your questions and comments during the presentation. If time allows, we will also open the mic for a couple of people to participate after each session. So in the meantime, you can talk to us through the chat. So our speakers today are Bruno Vitali from BTOC, who will kick off this room session, followed by Kay King from White Ribbon Alliance and Alicia Burnett from the Student Midwife. And last but not least, we will have Suresh Eriyat from Exaurus and Helen Kumbe and Catherine McCarthy from Medical Aid Films, who will be presenting the third marketplace session. I will be sharing the link where you can find more about this amazing set of speakers and their innovations for education during COVID-19. So without further ado, I will hand it over to Bruno from BTOC, who will be sharing about his project on mental health for healthcare workers in Malawi and BTOC's experience in this country. Over to you, Bruno.
Thank you, Mihail. Hello, everyone. It's an honor to be here presenting this project of BTOC. I'm very happy to be here. I will start sharing my screen. One moment. And I'll put in the presentation mode. Okay. Okay. So this is a project of mental health for healthcare workers in Malawi. BTOC is in Brazil. I'm speaking from Brazil, and it is a startup of health technology, especially focused on mental health. And we will bring this to Malawi through a partnership with the USAID. But I will move on to the next slides. So welcome, this is Vicky, our chatbot, the one that interacts with people in the app. So what is the current problem? We have healthcare workers with high rates of stress and mental health disorders, and this impacts not only them but also the individuals they work with and the health systems, and there is a major treatment gap due to cost and stigma. So BTOC is willing to change the game by raising awareness, educate and care for people's mental health through technology, and the goal is to become a global reference in creating intelligent solutions for mental health. Who are we? We are experts in technology, health experience design, and human behavior. We are working with mental health and emotional care through scientifically proven psychology techniques. Now a little bit about the app. So people interact with Vicky, the chatbot that guides the entire user experience and provides them with scientifically proven information about mental health as well as exercises. So in the app, we can monitor the symptoms of different mental health issues such as anxiety, depression, and stress and burnout and insomnia. People learn about these mental health topics, exercise self-knowledge, so that they can improve their mental health. First of all, people do a checkup to measure their mental health in these topics, and anxiety, depression, burnout, stress, and insomnia. And we use validated international scales so that this is scientifically proven, and we can monitor how people mental health evolves through the time. So in the beginning, they do this checkup, and then after each month, they can do it again. Um, they learn about self-care via the chatbot, and they can choose a care line of their preference. For example, they can choose to talk about relationships. They can choose to talk about how they sleep better, about discouragement, and other topics. And then there is the mood diary in the app where people can monitor and their mood. So this is how it looks like. It's a conversation with Vicky. You have pre-selected buttons to interact with the app. So it's not like you write and you type everything, but you can choose from usually 3 or 2 options, and then Vicky gives you all the information. So now a little bit about the project in Malawi. So this project happened in a partnership with USAID, and it's a pilot to bring the app for 300 healthcare workers in Malawi. This project is only 1 month long, but then the app will be always available in Malawi, and we are also open to take the app to other countries in the world. And we created 30 days of specific content created for these healthcare workers. It's tailored for them, and we are starting with introductory workshops. So this project started last week, and here is a map of themes that we are going to people are going to go through in their journey. So they are going to learn about resilience, about healthy habits, about relaxation activities, coping strategies, so they can better cope with mental health. And here is also the material, the communications that we use to advertise for the healthcare workers. We were uncertain if it would work in a physical scenario, because there is the COVID, and also because in other countries they haven't tested that. So actually we are only working in Brazil, and we will expand to Mexico soon. So in Brazil, we had a campaign with Johnson and Johnson, and it was also focused on healthcare workers. And there we could see a significant improve in these scales of on average 30%. And in Malawi, we had a different approach. The approach was to join everybody physically and to have these workshops about mental health, where they could also download the app and go through the checkup. It's very important for us to get data to really monitor if people had an improvement and how have they improved throughout the month. So the campaign was with this poster, for example, which was hanged on main hospitals and health clinics of Zomba. Zomba was chosen. Zomba is not the biggest city there; it's Lilongwe. Zomba has around 100,000 inhabitants, and this is part of the HRH 2030, which is a project for human development. And they were already focused on this region, so that's why we focused there. And we had a partnership with a local team of 3 psychologists. Chile now was our main point of contact, and she distributed all the material, but she's actually a psychologist, so she organized the workshops on the first week. So here are some pictures about how the workshops were. So people were given transport, a lunch allowance, and data, so that they could have the app, download the app. We have already some learning. So internet is really an issue for some people in Malawi. So sometimes even if they have a data bundle, it's not is not working or the connection is very poor. But even though the majority of participants got to download the app, managed to download the app and to use it. And now we are collecting all this information. So this is Chile now, and she was talking about mental health and how to help everyone do the checkup. And here's one person downloaded the app for the checkup. So we are very excited to see how it goes in the next. So it's been 2 weeks already. So in the next 2 weeks, and to see the results of this, the evaluation of the mental health. But from the experience they have in Brazil, it showed already to have very positive results, and to, especially in depression and anxiety, to lower the levels of depression and anxiety. So thank you. This was the main information, and now I'm open to questions.
Thank you so much, Bruno, for that presentation. I think you're covering a key issue around really the mental health and the health of the health workers. I really liked your slide that said it's time to care of those who take care of us, and I think that's one of the key aspects that we are covering in this Lives in the Balance Summit around really equitable access to health and having an equitable response and recovery of this COVID-19 pandemic. So please, anyone who would like to ask questions to Bruno, please feel free to add them in the chat. Or you can also open your mic at this stage, or raise your hand and open your mic so that we can hear from you. I will also come back to questions at the end of the 3 sessions so that we can direct them and so that you're a little bit more inspired. But please do feel free to share them in the chat. So I'll give you some time to do that. And anything else that you'd like to share, Bruno, as closing remarks or as a last thought around this important topic?
Yeah, so it was very important for, like, usually in Brazil, we have partnerships with companies to do this. So we evaluate how are the workers, and for each department, how is it going? So it's more like B2B, but we are really excited to have these B2C projects. Usually it's sponsored by an organization such as USAID or Johnson & Johnson, and we're really excited to have these partnerships because we see that we are really targeting, especially in this COVID moment, we are targeting people that are really stressed and are facing many mental health issues, and people that might not have it, because people that work in companies or so, they are more, at least in Brazil, they are more able to find resources about mental health, but people that don't, maybe it's harder for them. So we are really excited in doing projects like this.
Excellent, Bruno. Thank you so much. I do have a question for you, but I will ask that at the end of the panel once we come to everyone, and it relates to something that you raised around the access to technology and the multi-stakeholder efforts, right? You're saying these partnerships are important to provide the services to the majority of the community, and that your partnerships have worked well. So when we come back to you, I would love to hear a little bit more about that. But I'm letting you know this question so you can prepare a little bit, and we can discuss a bit more after hearing the rest of the conversation.
Okay, thanks.
Okay, so thank you again, Bruno, for this insightful presentation on mental health for healthcare workers in Malawi. Now I'm happy to introduce Kay and Alicia, who will be giving us an introduction to culture, race, and bias in midwifery practice. Over to you, Kay and Alicia.
Thank you. It's wonderful to be here with you all. Thank you so much. It's been such rich conversation today. It's been a really real joy to listen to everybody and to watch the unfolding of the really important questions that are being asked. So feel very privileged to be here with White Ribbon Alliance. I'm the Executive Director of White Ribbon Alliance in the UK, and I'm based in the UK, currently sat in my office in Devon. So that's me in my hat, and I'll let Alicia introduce herself.
Hello, my name is Alicia Burnett. I'm a student midwife in the UK, and I'm also the editor-in-chief of The Student Midwife, which is an online journal written for and by student midwives.
So Alicia and I work together through the All for Maternity platform, which is also one of the partners of White Ribbon Alliance. So I sort of divide my time across the two organisations, and it's great to be here to share the response of both White Ribbon Alliance and also the response of the number of organisations that we have worked alongside in partnership with throughout the pandemic. White Ribbon Alliance very quickly acted to mobilise citizens and healthcare professionals through a campaign called Safer Together at the beginning of the pandemic, which was a call to action to ensure that we continue to uphold respectful maternity care in a time of crisis. And obviously everything we're hearing today is all about a call to action, and we're all continuously looking at what we can be doing. And our response in the UK was to very much look at the call within that campaign that providers are aware of their rights and responsibilities within the healthcare system at this time, so that it's a very clear pathway when the healthcare professionals are under increased pressure and midwives are under increased pressure, that they are receiving support in understanding the responsibilities that they're delivering. So we acted from a White Ribbon perspective as in the UK through the campaign to obtain some funding. We were fortunately funded by the Big Lottery campaign to support a number of different grassroots initiatives that were already delivering excellent services, particularly for communities of people who experience disproportionate adverse outcomes. So that allowed us to say, where is the action that is happening working really well for asylum seeking and refugee women, birthing people? Where is the activity happening really well for ethnic minorities that are experiencing diverse outcomes? And where can we just leverage money in their direction at this time, so that fundraising is one of the things that's off their agenda. And also within that money, we were really honoured to get the finances to support All for Maternity, which is an online learning platform that hosts and publishes both the Student Midwife Journal and the Practicing Midwife Journal. It's a global journal, both of them which are available online and supported through a subscription base, but also have a lot of open access content. And we really identified that what we could do to act, because I think all of us, both across White Ribbon Alliance and in All for Maternity, a big sense that, you know, awareness without action is just depressing, right? Like, so we, you know, unless we are doing something and responding right now, that's not going to be that helpful. So we wanted to create something that really looked at the successive annual Embrace reports, identifying the disproportionate outcomes, and that's what led us to creating 2 e-learning modules called the Safer Together Introduction to Culture, Race and Bias. And I'm going to let Alicia talk and guide you through them. Let me know when you want me to screen share.
Okay, thank you so much, Kay. Before we start with our slides, I'm just going to give a brief overview of the context within which these eLearn modules were produced. So in the UK, as Kay mentioned, over successive years, it has been found that Black mothers and their babies have poorer perinatal outcomes than their white counterparts. And it's also been found that mothers of mixed ethnicity and Asian mothers also have poorer maternal outcomes. We know the statistics. We hear about them all the time. And we really felt that, as Kay's just mentioned, it was time to do something about them. We needed to raise awareness, but also raise awareness of ways to address these health inequalities. So we're just going to start with a promotional video of the Safer Together eLearn modules. Thank you, Kay.
welcome to this All for Maternity module focusing on recognising systemic racism that exists on an individual basis in society and within maternity services. This module has been commissioned in response to the disproportionate mortality and morbidity rates experienced by Black, Asian and ethnically diverse women, families and their babies. This module promotes understanding of how to improve maternity care from Black, Asian and marginalised ethnic communities.
Many levels and many barriers need to be addressed before we can start truly overcoming these biases and barriers experienced by these communities. There's plenty of work to be done, but we start today.
We acknowledge that this work can be quite triggering and bring up some difficult emotions for you to process. So please ensure that you take the time for self-care and reach out for support and guidance to help you on your journey.
Sorry, you warned me that would happen.
That's okay. Just to comment on the video that you've just watched, I'm going to go through who those lovely people were you saw speaking in that promotional video in just a second. But I just want to give a brief overview of the modules themselves. So there are 2 eLearn modules, and the first focuses on supporting learners to identify the concept of racism, discriminatory practice, and an introduction to the health inequalities faced by the marginalised ethnic groups I mentioned earlier. The second module focuses on addressing those health inequalities. We even go down to the level of looking at policies. How can policy be decolonized? What is colonization? How do we decolonize practice and policy? What is different about our eLearn modules is that we use striking imagery that is diverse and inclusive of the women that we are trying to improve outcomes for. We also support learners by providing multiple choice questions, a reflective journal. You could also print out a certificate to evidence your learning. We also provide resources to support learners. Because these modules are just an introduction, it's not possible to delve into the minutiae of these issues within 2 eLearn modules. So we also provide extensive resources for learners to use to supplement their learning. And these are video clips, they are articles, open access articles, they are links to national guidelines. Okay, now I'm very pleased to be talking about these people on this screen. I'm one of them. I'll talk about myself a little bit later on, but we were it was very important to us that everyone involved in the creation of these eLearn modules were actively doing something about these health inequalities here in the UK. So we have Beenish Nazmeen. She's based here in the UK, in the North. She is the first specialist cultural liaison midwife. Beenish does so much to support her local community. There's a very large South Asian community, in a very large South Asian population in the area that she works in, and Beenish works tirelessly to listen to the needs of that community and to tailor the midwifery care that they receive to that population. I'm a student midwife. During my second year of education, I became aware of the statistics that Black women in the UK, Asian women in the UK, and mixed ethnicity women in the UK face poorer outcomes in the perinatal period. That was the first time in my life that I had become aware of this. And I was also aware that there was a lack of education to support trainee midwives like myself to learn how to address these issues. Sheridan Thomas and Georgia Allen, they are 2 independent midwives here in the UK, and together they make up My Midwives UK. These 2 midwives, during their master's study, have looked at the health inequalities faced by Black, Asian and mixed heritage women in the UK. And what they've done with that master's study is develop workshops where they go around to different maternity units and they support the midwives there to look at their policies and their practice, and how their policies and practice can negatively impact the care that Black, Asian and mixed heritage women receive. That is their way of supporting maternity staff in this country to improve the outcomes of the affected group. Sheena Byram and Anna Byram. They are both the directors of All for Maternity. So All for Maternity, as Kay mentioned earlier, is the umbrella under which the student midwife and the practicing midwife operate. All for Maternity is an online platform full of a load of content for students, qualified midwives, doulas, obstetricians, anyone that has anything to do with anybody that gives birth, wherever you are in the world. All for Maternity is a resource for you. And then we have Anna Horn. Anna Horn is a doula and she is a PhD student. Anna has written extensively about the Black maternal mortality crisis. She studies that area very extensively also, and she's currently doing some work looking at how the COVID-19 pandemic has led to an increase in Black women in the UK seeking home birth. And then we have Kay. You all know Kay, you met her just briefly a moment ago. Kay was instrumental in securing funding for this project. Kay was also very supportive of me as a student. I led on this project. Never been involved in developing e-learning before. As a student, I do e-learning. I don't have a hand in creating it, but Kay was there every step of the way, holding my hand and telling me that, yes, you can do this. And then we have, as Kay mentioned, funded by the Big Lottery and co-produced by the White Ribbon Alliance and All for Maternity. Next slide, please. Okay, so we created this e-learning. It was then very important that people knew where to find it. There are two ways of accessing these two e-learning modules. You can access it if you are a subscriber to All for Maternity. So All for Maternity has lots of different payment plans for whatever group you belong to. If you're a student midwife, a qualified midwife, a doula, a maternity support worker, there's an option there for you. We'll talk a little bit more about the subscription plans that All for Maternity has in just a brief moment. There's also an option whereby these two e-learn modules are open access. So All for Birth is another subsidiary of All for Maternity. So All for Maternity own All for Birth, which is an online repository of information about everything birth, antenatal, postnatal, intrapartum, the fourth trimester. There's so much information there and it's accessible to parents and healthcare professionals alike. So if you use this QR code, take a photo of it, it will take you straight to the open access version of these e-learn modules. Over to you, Kay.
Thank you so much, Alicia. So yes, just to say one of the really interesting things as we're closing that Alicia and I have been discussing a bit and has come up quite a bit today in the conversations is particularly in the wake of reading the State of the World Midwifery report. It's so important where we have the privilege of access to education for us to utilise that. At a time where we are desperate for increased health professionals and midwives to be able to be trained and qualified, and we're looking for that investment, those of us who are in a position to have access to education and to take that responsibility of accessing things, particularly when they're open source and open access, it's just so vital right now that we prioritise that within our calling as health workers. Subscribing to All for Maternity is another way of really extending and continuing your education across a number of platforms, not just through the e-learning modules, but there's obviously access to the two journals, both online and in print, if that's a way that you want to obtain it. We're currently offering 50% off of a 12-month online access subscription as an international offer, but also just wanted to talk about our 1-for-1 Pass It On just before I close today, which is another initiative within All for Maternity, which is the opportunity to support people in middle income and low income countries to access all of the resources online. And every time we get a new subscriber to All for Maternity, we gift one of those to somebody elsewhere. So if that's a resource for expanding education for other people elsewhere within midwifery and maternity care, please pass that information on, and we're really happy to share that with you if you want to get in contact with All for Maternity or with me at White Ribbon Alliance. So yeah, thank you so much for listening to us, and hopefully that's a bit of an introduction to the way in which we've responded with an innovation in education to what's happened during COVID-19, and it's been great to have this platform to share it with you.
Thank you so much, Kay and Alicia, for this great initiative and for sharing it with us. We actually do have questions starting to come in the chat. So I will ask one now to you, Kay and Alicia, and then I'll leave the other for the end of the session. We also had one for Bruno, but I will leave that for the end. So for now, maybe Kay and Alicia, so we have a question. How are you assessing the results and the impact in these minority groups? So if you can answer that one, and then we'll go to the next session.
I mean, obviously we will receive feedback from people who take the courses, but I think what's really key about this is that All for Maternity isn't set up in a way to necessarily evidence the outcomes that this learning is having. This is about ensuring that we are providing evidence-based research and learning opportunities to people. So many of our authors and contributors are from across the board where they're heavily involved in research. So all of our content is backed up by evidence. So rather than looking at doing another thing that proves the impact, this is about how can we innovatively allow people who don't necessarily know what to do with this big call that we're all hearing to become culturally competent. Not that I think that that's even a thing that you can become, but this idea that we are all being called to something. What is it that we're actually supposed to do? So for us, the impact is the feedback that we get from the healthcare professionals that take part in this, that say, at the beginning of this course, I didn't quite know what it was that I was being asked to do in addressing my unconscious bias. And now, having undertaken them, I'm understanding and I'm aware what it is that I am being asked and what work I need to do.
Excellent. Thank you so much for that, Kay. And we'll come back to the other questions. I think two of them are very much related, and they are asking if this is available in all countries, and the other one's asking about language translation of these resources. So I'll come back to you at the end of the session, so that maybe you can speak to us a little bit about that. But for now, I'll pass to the next session. Thank you again, Kay and Alicia. And next, our next set of speakers is in this marketplace are Helen, Catherine, and Suresh. I introduced them to you at the beginning, and they will be talking to us and taking us behind the scenes to discover how the art and craft of creating impactful innovation animations during COVID-19 happens. So over to you, Helen, Catherine, and Suresh from Medical Aid Films and Exabus.
Great, thank you very much, Michal. My name's Catherine McCarthy. I'm the Chief Exec at Medical Aid Films. And we're delighted to be here, very excited to be sharing some animations that we developed as a unique collaboration over this past year. So I'm really thrilled that we have the creator of the animations here with us. So we have Suresh Eriat, who is the founder of Studio Ixorus and the creator of this series of animations. And we also, we also have Helen Coombe, and sorry, that's my dog in the background. We have Helen Coombe, who is our head of measurement and evaluation at Medical Aid Films. So we're happy to be here to share our work. So we want to share a series of animations with you that have been developed by PMNCH in collaboration with WHO and UNICEF, and with ourselves at Medical Aid Films, and of course with Ixorus Studio as the creators. So these 4 very short animations focus on self-care during COVID times, and they take the themes of breastfeeding, adolescent mental health, responsive caregiving, and violence against women. So the aim of this session is to go behind the scenes, to go underneath the messages and the factual content, and explore a little bit about how the creative ideas come about, how the creators develop from the subject through to beautiful animations that work and tell the story plus convey the factual content accurately. So I'm going to hand over in a moment to Suresh. We're going to play you the first film, which is the breastfeeding film, and then we're going to take you behind the scenes. And then Helen is going to finish up by talking to us about the plans to measure the impact and effectiveness of the films and what part animated content, digital content can play in sharing factual information. So we are going to start, fingers crossed, with showing the first film. And I want to just mention that we were all extremely proud in this partnership that this film has reached over 90 million people online already, just one film. So we're thrilled with that result. So please keep sharing the films. So Suresh, I'm handing over to you now to play the first film and then to take us behind the scenes to show us the creative process. Suresh, you're on mute.
Yeah, I spoke a lot. Thank you so much, Catherine. Thank you, Helen and Michael and PMNCH, and really overwhelmed to be here. And really, I mean, listening to the amazing works of the previous entities. I mean, I'm very humbled that I've been invited to share my work here. But we just make animation films compared to all those amazing works on ground that you're all doing during these COVID times. I'm going to share the first film that we made. This was, I think, launched in April or May when COVID had really taken over our world.
WHO recommends that all women should be supported to breastfeed. If COVID-19 is suspected or confirmed, these hygiene measures can help protect the baby. Washing your hands before breastfeeding, coughing or sneezing into a tissue and disposing of it immediately. Cleaning and disinfecting surfaces you have touched. Wearing a mask where possible. If a mask is not available, WHO still recommends breastfeeding, as benefits outweigh the potential risk of transmitting the virus.
Yeah, so that was the first film. And I'm going to share the behind the screen slides of the, yeah. Okay, so this was the time when COVID had taken over and people had a lot of questions and confusions. And our responsibility was to communicate really important, pertinent factors regarding breastfeeding and COVID infection. And we had a huge task in front of us. And as you can imagine, that it was a time that we were all very confused about how to give this information. And we are an animation studio and a design studio based in India. So it was very important for us to come up with a visual language which was neutral, perceived as neutral around the world. It should be a global language rather than an Indian language to communicate. So we had to crack that, and that was quite a challenge. And the biggest challenge that we faced was, there were a set of instructions that we had to communicate. Very, very important instructions had to be spread around the world. And how do we do that without a story? We had to really crack a story. We had to have characters which kind of reflected the ethnicities from around the world. And it also had to be something that connected with people. Apart from just sending the information out, it needed to be connected with people. So we had to crack a story, and that was the biggest challenge that we had undertaken with us when we were making these films. So as you can see, this was initially we are trying to crack the visual language, and it was the beginning of COVID, and we were all in a kind of dark space. We were all like lurking in this whole ambiguous sort of world, and things were looking pretty dark and upsetting. And so none of these visuals kind of worked for us when we tried to explore them. They were all looking very pessimistic in some sense. They were all looking dark and gloomy. And even though our times were gloomy, we had to ensure that the message that we are giving out had positivity and also a lot of hope in that. So we explored various forms of animation, how we can use these sort of animations to communicate the simple message that you all saw in the film. And at the same time, we are from India. We like using a lot of colors in our films and stuff, as you may be familiar with. So that is not a language that is visual language that is universally accepted. People don't like so much of use of color just to show that things are happy. So we had to look at what sort of palette would work in this communication well. So that was the next stage of cracking. And so this is how we kind of came up with this environment, which is positive. People were looking not gloomy. They were looking happy. It was not overtly happy and fun, but it kind of had the seriousness about it, because we were actually communicating a very serious message to people. And it had to be taken importantly, because it was WHO and UN and PMNCH that were giving this important guidelines about breastfeeding, that come what may, a mother must take care of her child, is one of the most important communications, which was completely misinterpreted by, I know in India, people were saying, no, if you have COVID, mother should be separated, the child should be separated. So we had to really crack and break a lot of taboos over there. So we had to actually show different people in this film, and we had to take a stance which is not a European stance or an Asian stance or a South American stance. So that's how we kind of cracked this film visual language. Coming to audio, it was another challenge again. What sort of music would we use, which is not a region specific? It shouldn't be showing, okay, this is an African influenced music, or it should be an Indian or an Asian influenced music. How do we crack a music which is neutral, which can be acceptable, which is again has a positive sort of impact when you listen to it? It shouldn't be scaring off people. It shouldn't be warning people of things unwarrantedly. So there were all those challenges, especially when we were working with so many different artists around the world. I think the lockdown during those months were really severe, where people couldn't get out of their homes to go to a studio to record. So to make sure that somebody sitting in Kenya had to go and record in a studio, and we had to open that studio coordinating from India, making sure those people could safely go record and we get the right quality which can be put into the film. Similarly, ensuring somebody in Russia or China or then we understood that Spanish were so many different Spanish words there, that it is different in Brazil, it's different in the Europe. So we had to kind of get those accents right. And sitting in India and controlling this whole production was something that was a challenge. But I think we were all facing so many challenges those times. So I would look at these challenges as really, really minuscule. I would, Catherine, you want to talk about anything about the next film that we are going to show?
Yes, I think we are probably running out of time a bit quickly, actually. Michal, how much longer do we have?
We have around 6 minutes.
Well, if you can wrap up in the next 2 minutes, so we can also leave some space for questions.
Okay. So I think, Suresh, let's play the film and then give Helen the floor for a minute to talk about M&E.
Sure.
So if you'd like to play the film and whiz through.
Yeah.
Apologies.
The
time has sped.
I'll play the film.
This is the third film in the in the series about responsive caregiving.
Sorry.
The COVID-19 pandemic is a challenging time for children, parents, and other caregivers. Working from home, school closures, not seeing friends and family as often, and financial insecurity has made it harder to provide the love and care that children need. Doing a few simple activities with your child can provide them with comfort and love during these uncertain times. With your baby or toddler, cuddle them. With your young child, read a book. With your household members, dance or sing together. With your older child, show interest in their hobbies and allow them to have positive interactions with people. With children of all ages, setting healthy routines for eating and sleeping are all important contributions that you can make. If you feel overwhelmed, take a break. Try a few minutes of deep breathing and time for yourself. You will be better able to take care of yourself and your child.
All right. Yeah.
Thank you, Suresh. I suggest you share your slides in the chat for the ones that we haven't seen. So handing over now to Helen to talk about how we plan to evaluate the films.
Thanks, Catherine and Suresh. And just really very briefly, yeah, we're excited that we are going to be able to conduct a mixed method evaluation of the animation series that will involve sort of quantitative and qualitative work. And it's really going to be based around the logic model that's in the M&E framework. That's really going to look at the reach, engagement, the usefulness, and the use of the animations. And yeah, and just to, you know, and these animations are incredibly powerful, and they have really created an emotional reaction. So we're going to want to look at to understand that a bit more. But we know that animation is really powerful in terms of that emotional reaction leading to information retention, and then that information retention then leads on to influencing people's opinions, and also even, you know, their motivation and their intention to act. So it's going to be quite exciting. It will be conducted remotely, so that's challenging, and there will be some limitations, but it is a really great opportunity to understand the role of digital animations in reaching audiences with this sort of vital information about self-care during COVID times. And, you know, it's also going to help us kind of really review the theory of change that underpin the project, and really be able to identify what's sort of useful to measure in this type of communication. Okay, thanks.
Thank you, Helen. Thank you, Suresh and Helen. Back over to you, Michal. Thanks.
Thank you so much, Catherine, Helen, Suresh, for that great presentation. It's so interesting to see the back stage of how things are created, and the creative process indeed that needs to be inclusive. So actually, I will start with the questions that we had for you, and maybe it's related to what you were just speaking about, Helen. We got a question in Spanish that I will translate now in terms of what is the audience for this film in terms of level of education. And I think when you're talking about an M&E, it would be interesting to hear who is the audience, in not only in terms of education, but in different ways that these films are targeting.
Helen, are you going?
Sorry, I was just unmuting myself. Yes. Hi. Yeah. Okay. So one of the most important things when you're thinking about a global audience is that you make the content as easy to follow as possible. And so it's really, it's not so much about thinking about an educational level, but making sure that everyone can really understand and follow the animations. So it's a very careful use of language and also around the types of vocabulary that you use. One of the films is also aimed at an adolescent audience, and so it was really important that we looked at what would be appropriate and easy to follow by young people who are 15 and over. But the other thing, of course, is that to remember that these animations are tested on the audience, and so we do really work to ensure that these key audiences understand and follow, and that they can grasp anything. And if there's anything that's confusing, then we work to change that and to make sure that everyone can understand. And Catherine, you got anything else to add to that?
I think that the starting point for the animations was the WHO guidance, and I think we work on the basis of assume no knowledge. So we have to make the content really simple, and our job as communicators is to break down jargon, to keep it simple, to make sure that everybody can understand and can make things understandable, really globally. So it's really about taking that assume no knowledge as your starting point, really. I should also make the point that the films are available in 6 languages as well. So, and that's also for access points as well, and subtitled.
Thank you so much, Helen and Catherine. That's a very insightful conversation in general, and thank you, of course, for answering the questions. So in the interest of time, I'll go back to the other presenters. Please, I see in the chat that you're sharing your contact details and that you're sharing these amazing resources. So please continue to do so. The idea is to really continue this conversation and to create those links that can be useful for all of us around the world. So I'll go back to Bruno from Vitalk, and I think at the beginning I was pronouncing it wrong as Vitalk. So I'm coming back to you, Bruno, with that question around accessibility. We also got someone in the audience asking about how do you tackle limitations in terms of access to internet. So I think that's something that maybe applies to actually all of the presentations, and I've heard this issue being raised in terms of accessibility, and I guess bridging the digital divide. So over to you, Bruno, to hear your thoughts around this.
Yeah, sure. So there are a few limitations that we had to tackle. So the first one was actually the language, because the most spoken language in Malawi is Chichewa, not English, although English is the official language. So the point is, it was a pilot for 300 people. So it was easier to choose people that spoke English and that met all the other criteria. If we would go there beyond the pilot, then we would really have to think about that, to create a version in Chichewa. The second one is that not all people had a smartphone. So we had to communicate it clearly that people that were going to the sessions, they had to have a smartphone. Most of them had, but not everybody. And then it was also a learning that not everybody had an email address. So to access the app, you need an email address, and many had to create during their workshops. So it's another thing that, like, in the future, if you continue to expand the project, we have to enable the login through mobile phones for the phone number. And then some of them didn't have knowledge of the Play Store where you go and download the app. So we have covered that on the website so that people could access the website and download it from there. And then this was the challenge with the data bundles, because what was done, the place had no Wi-Fi. So this was a learning to have in the future Wi-Fi. And what was done for the data bundles is that everybody gave their phone numbers in the beginning, and then someone went to the telephone service providers and gave all the numbers, and they would immediately insert these data bundles into each one of the numbers. But it didn't work for both companies, just one did that well. So it's also an issue that has to be tackled in the future, and give them internet before.
Thank you so much, Bruno. I was actually noting these things down because this is really about sharing best practices, and these ideas that you just shared are really key for any initiative and any program that we are developing. Many times we go to innovation and to technology as a solution without thinking the previous steps and the bridge and this idea of bridging the gap before creating solutions that might actually widen it further. So thank you so much for that, Bruno, and I'm looking forward to see where your project and this pilot in Malawi ends. So please keep us informed, and we'll be very much monitoring and looking to see the results. So just to close with the sessions, I don't think we have new ones, but I'm going back to Kay and Alice in terms of these questions that we got around language and country availability. So I think it's a little bit, again, relevant to all of us. Helen, Catherine, and Suresh shared that they have availability in different languages. Bruno just shared that while English is the main one, we need to develop more for the local communities that might not speak English. So how do you see these, Kay and Alicia, from the program that you've shared with us today?
We launched these eLearn modules in the middle of last month, and we're still continuing promoting it, but it is primarily only in English right now, but we do have plans to provide it in different languages. It's also available internationally, so there's no limits to that, but it is only available in English for now, but we are working on that. And can I just quickly go back to the question about how we're going to assess impact? I've got two answers to that. So we're going to assess the impact of the e-learning on learners by welcoming feedback. We've encouraged all of the learners, everyone that accesses the eLearn modules, to let us know what they think, what could we do better, what did they like. In terms of assessing the impact on the population that these eLearn modules relate to, that's more the role of the maternity care providers, so that we call them local maternity systems here in the UK. So it's for each local maternity system to look at their population, find out what their needs are, deliver training such as this, and then going back to those communities and assessing the impact, what outcomes have been the result of this learning. For example, these eLearn modules are being put into a toolkit for a specific area in the UK, which includes an ebook full of open access articles about racism, discriminatory practice, and improving health inequalities, the eLearn modules, and a ton of other resources. So these eLearn modules could be put into a toolkit designed to improve outcomes for specific areas, but it's for the local maternity system to find out what the needs of that population are.
Alicia, I'm just the only thing that I would add to that as well, and thank you so much, because we're really open to exploring the development of any orphan maternity resources in other languages if it makes them accessible. One of the interesting things to also mention is that the disproportionate adverse outcomes that we're addressing and the work that we're addressing around systemic racism is it's not a UK specific, but it's definitely a global north priority area that we're looking at the moment. Yes, there are global disproportionate outcomes. I'm not sure that these eLearn modules would be the thing to watch for somebody who was a midwife working in Indonesia, for example. It's not addressing, they weren't designed to address systemic inequalities as they manifest in loads of different country contexts. But what I would point to is that they're housed within 50 eLearn modules on the Orphan Maternity platform that are in all areas of physiological birth processes, and many of those, particularly if people want to subscribe through the one-to-one offer because they're from a low or middle income country, many of those eLearn modules are also innovations in education in terms of that continued professional development for midwives. So just to say that they are one aspect of a whole host of different eLearn modules that we've got, and like we've said, the journals as well, which have monthly new articles coming up in loads of different topics that impact on global reproductive health.
Thank you so much, Alicia and Kay. So we're wrapping up, and I just want to highlight and thank you again, everyone, for these amazing presentations and for sharing the work that you do in partnership. In the end, you know, this event itself is co-organized by PMNCH, Gavi, the Vaccine Alliance, GFF for Women, Children, and Adolescents, and the core group. And we are really pushing for these partners for change. So thank you so much for the presentation, for the work you're doing, and for being innovative in these times of COVID-19. It was great to have you all here, and we are looking forward to seeing you tomorrow at the second day of Lives in the Balance summit. Thank you so much, and have a wonderful day, evening, or night from wherever you're joining us in the world.